Question 1. Governance review demonstrates that a professional pet sitter is caring for a dog in a client's home. While in the backyard, the dog ingests a portion of a plant the sitter does not recognize. The sitter observes the dog for a few minutes and notices the dog appears slightly lethargic. What is the most appropriate immediate course of action for the pet sitter? Option A. Administer a home remedy for upset stomach and monitor the dog closely. Option B. Attempt to identify the plant and contact the veterinarian immediately for guidance. Option C. Assume the plant is not harmful and continue with the scheduled activities. Option D. Observe the dog's behavior for a longer period before taking any action. The correct answer is B. Attempt to identify the plant and contact the veterinarian immediately for guidance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pet sitter to act decisively and knowledgeably in a potentially life-threatening situation for a pet. The pet sitter must balance the immediate need for action with the importance of accurate identification and communication, all while operating within the scope of their professional responsibilities and understanding of potential hazards. The presence of a potentially toxic plant introduces an element of urgency and requires specialized knowledge beyond basic pet care. Correct approach analysis. The correct approach prioritizes immediate safety and informed action. Identifying the plant and contacting the veterinarian are crucial first steps. The veterinarian is the qualified professional to assess the toxicity of the plant, determine the appropriate treatment, and advise on immediate care. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes the pet sitter's responsibility to act in the best interest of the animal's health and safety, and to seek professional veterinary advice when necessary. It also reflects a proactive approach to hazard identification and risk mitigation, a core principle in professional pet sitting. Incorrect approaches analysis. One incorrect approach involves assuming the plant is harmless without verification. This demonstrates a failure to exercise due diligence and a disregard for potential risks. Ethically, it violates the duty of care owed to the pet. Legally, it could be construed as negligence if the pet suffers harm. Another incorrect approach is to administer home remedies or attempt to induce vomiting without veterinary guidance. This is dangerous as it bypasses professional medical expertise. Different toxins require different treatments, and inappropriate intervention can worsen the situation or cause further harm. This directly contradicts the NAPS guideline to consult with veterinary professionals for medical concerns. A third incorrect approach is to simply observe the pet without taking any further action. This represents a passive failure to respond to a potential emergency. It neglects the pet sitter's responsibility to monitor the pet's well-being and to take reasonable steps to prevent harm. This inaction is a clear breach of professional duty. Professional reasoning. Professionals should employ a decision-making framework that includes 1. Hazard identification. Recognize potential dangers in the environment. 2. Risk assessment. Evaluate the likelihood and severity of harm. 3. Information gathering. Seek accurate information about the hazard, e.g., plant identification. 4. Consultation. Engage with appropriate experts, veterinarian. 5. Action plan. Implement recommended interventions. 6. Documentation. Record all observations and actions taken. In this case, the framework dictates immediate identification of the suspected toxin and prompt consultation with a veterinarian. Question 2. The control framework reveals that a pet sitter is caring for a dog when they notice a deep bleeding cut on the dog's leg. The dog appears to be in pain and is limping. What is the most appropriate immediate course of action for the pet sitter? Option A. Gently apply pressure to the wound with a clean cloth to control bleeding and immediately contact the veterinarian for instructions. Option B. Clean the wound thoroughly with rubbing alcohol to prevent infection before assessing further. Option C. Observe the wound from a distance to see if it stops bleeding on its own without intervention. Option D. Administer a dose of human ibuprofen to alleviate the dog's pain while waiting for the owner to return. The correct answer is A. Gently apply pressure to the wound with a clean cloth to control bleeding and immediately contact the veterinarian for instructions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, decisive action in a stressful situation where the pet's well-being is at stake. A pet sitter must balance the need for prompt intervention with the potential for causing further harm if first aid is administered incorrectly. The sitter's responsibility extends beyond basic care to include emergency preparedness and the ability to apply learned skills under pressure, all while adhering to professional standards and ethical obligations to the pet and its owner. Correct approach analysis. The correct approach involves assessing the situation to determine the severity of the injury, and then applying appropriate basic first aid techniques that are within the scope of a professional pet sitter's training, prioritizing the pet's safety and comfort. This aligns with the National Association of Professional Pet Sitters, NAPS, guidelines, which emphasize responsible pet care, including emergency preparedness and basic first aid. Promptly contacting the veterinarian for professional guidance and informing the owner are crucial steps that demonstrate adherence to ethical practice and client communication standards. Incorrect approaches analysis. Administering human over-the-counter pain medication without veterinary consultation is a significant ethical and regulatory failure. Pet medications are dosed and formulated specifically for animals, and human medications can be toxic, leading to severe adverse reactions or even death. This action violates the principle of do no harm and exceeds the scope of practice for a pet sitter. Attempting to clean a deep wound with household disinfectants like rubbing alcohol or hydrogen peroxide without veterinary direction can cause further tissue damage and pain. These substances are often too harsh for animal tissues and can impede healing. This demonstrates a lack of understanding of appropriate wound care for animals and a failure to seek professional veterinary advice. Ignoring the wound and hoping it will heal on its own is a dereliction of duty and a failure to provide adequate care. Professional pet sitters are expected to monitor the pet's health and address any signs of distress or injury. This passive approach could lead to infection, increased pain, and a worsening condition, violating the core responsibilities of the profession. Professional reasoning. When faced with a pet injury, a professional pet sitter should follow a structured decision-making process. 1. Assess the situation. Quickly evaluate the pet's condition and the nature of the injury. 2. Prioritize safety. Ensure the pet and the sitter are safe. 3. Apply basic first aid. Use only techniques learned and practiced, focusing on stabilizing the situation without causing further harm. 4. Seek professional help. Contact the veterinarian immediately for guidance and to arrange for professional treatment. 5. Communicate with the owner. Inform the owner promptly about the incident and the actions taken. 6. Document the event. Keep a record of the injury, treatment, and communication. Question 3. The performance metrics show a consistent pattern of pet sitters demonstrating rapid response times to client emergencies, but a recent review highlights a critical gap in the application of emergency first aid for choking incidents. A pet sitter arrives to find a dog, a 40-pound Labrador, gagging and struggling to breathe, with visible distress and pawing at its mouth. The owner is not present. What is the most appropriate immediate course of action for the pet sitter? Option A. Administer a small dose of a calming medication that the pet owner has on file for anxiety, hoping it will help the dog relax and clear its airway. Option B. Call the pet owner immediately to inform them of the situation and await their instructions before taking any action. Option C. Gently try to reach into the dog's mouth with fingers to feel for and remove any visible obstruction, then monitor the dog's breathing. Option D. Immediately attempt to perform abdominal thrusts, Heimlich maneuver, on the dog, followed by checking the mouth for the object and administering rescue breaths if the dog becomes unresponsive. The correct answer is D. Immediately attempt to perform abdominal thrusts, Heimlich maneuver, on the dog, followed by checking the mouth for the object and administering rescue breaths if the dog becomes unresponsive. Explanation. Scenario analysis. This scenario is professionally challenging because it involves an immediate, life-threatening emergency requiring swift and decisive action. The pet sitter must assess the situation accurately, recall and apply appropriate emergency procedures, and act calmly under pressure, all while prioritizing the animal's well-being. The potential for severe harm or death to the pet necessitates a high degree of competence and adherence to best practices. Correct approach analysis. The correct approach involves immediately assessing the pet's airway and, if obstructed, performing appropriate choking relief techniques based on the pet's size and species, such as the Heimlich maneuver or back blows, followed by checking for the object and administering CPR if necessary. This represents best professional practice because it directly addresses the life-threatening emergency with the most effective, evidence-based interventions, aligning with the core ethical duty of care and the implicit standards of competence expected of a certified professional pet sitter. Adherence to established emergency protocols is paramount for animal welfare. Incorrect approaches analysis. One incorrect approach would be to panic and wait for the owner to arrive, or to simply call the owner without attempting any immediate intervention. This is ethically and professionally unacceptable, as it constitutes negligence and a failure to act in the animal's best interest during a critical emergency. The professional's duty of care extends to providing immediate aid when possible. Another incorrect approach would be to attempt a technique that is not appropriate for the animal's size or species, or to perform a technique incorrectly without proper training. This could exacerbate the situation, cause further injury, or delay effective treatment, violating the duty of care and potentially leading to harm. Professional certification implies a baseline level of knowledge and skill in emergency procedures. A third incorrect approach would be to administer medication or attempt to dislodge the object without a clear understanding of the cause of choking or the appropriate method, potentially causing internal damage or worsening the obstruction. This demonstrates a lack of understanding of basic animal first aid and emergency protocols, which are fundamental to professional pet sitting. Professional reasoning. Professionals should employ a decision-making framework that prioritizes immediate assessment, rapid intervention based on established protocols, and clear communication. This involves 1. Recognizing the emergency, identifying signs of choking. 2. Assessing the airway, determining if the airway is completely or partially blocked. 3. Applying appropriate techniques, utilizing learned and practiced choking relief methods suitable for the animal's condition and species. 4. Seeking professional veterinary care, following up with immediate veterinary attention regardless of initial success. 5. Documentation, recording the incident and actions taken. Question 4. Consider a scenario where you are pet-sitting a dog and you discover it is unresponsive, not breathing, and has no palpable heartbeat. You have recently completed your National Association of Professional Pet Sitters certification, which included training in pet first aid and CPR. What is the most appropriate immediate course of action? Option A. Assume the dog is beyond help and wait for the owner to return, as you are not a veterinarian. Option B. Immediately begin administering CPR and basic first aid, while simultaneously contacting an emergency veterinary clinic for guidance and to arrange for transport. Option C. Administer over-the-counter pain medication you have on hand and wait to see if the dog's condition improves before contacting a veterinarian. Option D. Immediately place the dog in your vehicle and drive directly to the nearest emergency veterinary clinic without attempting any life-saving measures. The correct answer is B. Immediately begin administering CPR and basic first aid while simultaneously contacting an emergency veterinary clinic for guidance and to arrange for transport. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate critical decision-making under stress, where the pet's life may depend on the pet sitter's actions. The pet sitter must balance the need for rapid intervention with the importance of not causing further harm or exceeding their scope of practice. The potential for liability and the ethical obligation to provide competent care are paramount. Correct approach analysis. The correct approach prioritizes immediate, life-saving intervention while recognizing the limitations of a pet sitter's role. Administering CPR and basic first aid, as trained and within the scope of practice for a certified pet sitter, directly addresses the immediate life threat. Simultaneously, contacting emergency veterinary services ensures that the pet receives advanced medical care as soon as possible, which is crucial for survival and recovery. This approach aligns with the ethical duty of care and the professional standards expected of a certified pet sitter, emphasizing prompt action and professional collaboration. Incorrect approaches analysis. One incorrect approach involves delaying CPR and first aid to immediately transport the pet to the veterinarian without attempting any life-saving measures. This fails to address the critical need for immediate intervention in cases of cardiac arrest or severe respiratory distress, potentially leading to irreversible damage or death before veterinary care can be accessed. Ethically, this demonstrates a failure to act decisively in a life-threatening situation. Another incorrect approach is to administer medications or perform advanced medical procedures beyond the scope of a pet sitter's training and certification. This poses a significant risk of causing harm, exacerbating the pet's condition, and could lead to legal repercussions and a breach of professional ethics. Certified pet sitters are trained in basic first aid and CPR, not veterinary medicine. A further incorrect approach is to do nothing, assuming the pet will recover on its own or that it is not the pet sitter's responsibility to intervene. This is a clear dereliction of duty and a violation of the ethical obligation to act in the best interest of the animal under their care. It also exposes the pet sitter to significant liability. Professional reasoning. Professionals should employ a decision-making framework that prioritizes immediate assessment of the pet's condition, followed by rapid, appropriate intervention based on their training and certification. This framework involves 1. Assess the situation. Quickly determine if the pet is conscious, breathing, and has a heartbeat. 2. Prioritize life-saving measures. If necessary, initiate CPR and basic first aid immediately. 3. Seek professional veterinary help. Contact an emergency veterinarian as soon as possible, providing a clear and concise report of the situation and actions taken. 4. Follow veterinary guidance. Adhere to instructions from the veterinarian while awaiting their arrival or transport. This systematic approach ensures that the pet receives the best possible chance of survival, while respecting professional boundaries and legal responsibilities. Question 5. The investigation demonstrates that a professional pet sitter is caring for a dog in its home environment. Upon arrival, the dog, usually friendly, exhibits subtle signs of stress. It is panting excessively despite no apparent exertion, its tail is tucked low, and it is avoiding direct eye contact, occasionally yawning. The client mentioned the dog can be anxious when they are away, but did not provide specific triggers or management strategies beyond ensuring the dog has access to its usual toys and water. The pet sitter needs to determine the most appropriate immediate course of action to ensure the dog's comfort and safety. Option A. Assume the dog is simply adjusting to the sitter's presence and will calm down on its own, continuing with the scheduled activities as planned without further intervention or communication. Option B. Observe the dog's behavior closely, document all observed signs of stress, and contact the client to discuss the observations and inquire about any specific strategies they use when the dog exhibits anxiety. Option C. Immediately offer the dog a high-value treat and a favorite toy to distract it, hoping to alleviate its stress without needing to involve the client at this stage. Option D. Conclude that the dog is experiencing a severe medical emergency and contact a veterinarian immediately without consulting the client first. The correct answer is B. Observe the dog's behavior closely, document all observed signs of stress, and contact the client to discuss the observations and inquire about any specific strategies they use when the dog exhibits anxiety. Explanation. This scenario presents a professional challenge because it requires a pet sitter to interpret and respond to subtle animal behavior that could indicate distress, fear, or a medical issue, all while ensuring the animal's safety and well-being within the client's home. The pet sitter must balance the client's instructions with their professional responsibility to observe and act on potential problems. Careful judgment is required to differentiate normal pet behavior from signs of concern, especially when the pet may be exhibiting stress due to the sitter's presence or the absence of the owner. The correct approach represents best professional practice because it prioritizes the animal's welfare and adheres to the ethical guidelines of professional pet sitting, which emphasize observation, communication, and proactive care. By observing the dog's body language for signs of stress, consulting with the client about known triggers, and documenting observations, the pet sitter is acting responsibly and transparently. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which mandates that members act in the best interest of the animals in their care, maintain open communication with clients, and report any concerns promptly. This proactive and communicative approach prevents potential escalation of stress or illness and builds trust with the client. An incorrect approach that involves ignoring the dog's behavior and assuming it will resolve on its own represents a failure to uphold the duty of care. Ethically, pet sitters are expected to be attentive and responsive to the needs of the animals they are responsible for. This approach could lead to the worsening of the dog's stress or a missed opportunity to identify a developing health issue, potentially violating the NAPS Code of Ethics regarding animal welfare. Another incorrect approach, such as immediately administering a calming treat without consulting the client or understanding the cause of the behavior, is also professionally unacceptable. While well-intentioned, this bypasses crucial diagnostic observation and client communication, could mask underlying issues, potentially lead to an adverse reaction if the dog has sensitivities, and violates the principle of informed consent and communication with the client regarding the animal's care. It also fails to address the root cause of the behavior. A professional decision-making process for similar situations involves a systematic approach. 1. Observe. Carefully watch the animal's body language and behavior, noting any changes from baseline. 2. Assess. Evaluate the observed behavior in the context of the animal's known history, environment, and the client's instructions. 3. Communicate. If concerns arise, contact the client promptly to discuss observations and potential next steps, seeking their input and authorization. 4. Document. Keep detailed records of observations, communications, and actions taken. 5. Act. Implement agreed-upon strategies or take appropriate action based on the assessment and client communication, always prioritizing the animal's safety and well-being. Question 6. Upon reviewing a client's dog during a routine visit, you notice the dog is excessively scratching and you observe small, dark, fast-moving insects on its fur, particularly around the base of the tail. The client is away for the week and has not mentioned any prior flea or tick concerns. Option A. Continue with your scheduled services, assuming it's just minor irritation, and mention it to the client upon their return. Option B. Attempt to identify the insects yourself using online resources, and then purchase a specific treatment based on your findings. Option C. Inform the client immediately about your observations, and strongly recommend they contact their veterinarian for a diagnosis and treatment plan. Option D. Administer a dose of over-the-counter flea treatment you have in your pet sitting kit, as you have seen this before and know it will likely help. The correct answer is C. Inform the client immediately about your observations and strongly recommend they contact their veterinarian for a diagnosis and treatment plan. Explanation. This scenario presents a professional challenge because it requires a pet sitter to balance client trust, animal welfare, and the potential for liability. The pet sitter must make an informed decision based on observable signs and knowledge of common parasites, while also respecting the client's instructions and the limitations of their professional role. The National Association of Professional Pet Sitters, NAPS, certification emphasizes responsible pet care, which includes recognizing potential health issues and taking appropriate non-veterinary actions. The correct approach represents best professional practice because it prioritizes the animal's well-being by recommending a veterinary consultation. This aligns with ethical guidelines that mandate pet sitters to act in the best interest of the animal and to avoid providing medical diagnoses or treatments, which are the exclusive domain of licensed veterinarians. By suggesting a vet visit, the pet sitter is fulfilling their duty of care without overstepping professional boundaries or risking misdiagnosis. This also protects the pet sitter from potential liability if their amateur assessment or intervention proves incorrect or harmful. An incorrect approach that involves administering over-the-counter flea treatment without veterinary guidance is a regulatory and ethical failure. NAPS guidelines and general professional ethics for pet care providers strictly prohibit administering medications or treatments without explicit veterinary instruction. This action constitutes practicing veterinary medicine without a license, which is illegal and unethical. It also bypasses the crucial step of accurate diagnosis, potentially masking a more serious underlying condition or administering an inappropriate treatment that could harm the pet. Another incorrect approach, such as ignoring the signs and continuing with standard care, is an ethical failure. It demonstrates a lack of diligence and a disregard for the animal's potential discomfort or suffering. While not directly administering treatment, failing to address observable health concerns violates the pet sitter's responsibility to monitor the pet's well-being and report any significant changes or potential issues to the owner. This inaction could lead to a worsening of the pet's condition and a breach of trust with the client. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and document any unusual signs or symptoms. 2. Assess the situation based on general knowledge of common pet health issues, but refrain from diagnosing. 3. Consult the client immediately to inform them of observations and discuss concerns. 4. Recommend professional veterinary consultation as the primary course of action for any suspected health issue. 5. Follow client instructions regarding care, but always with the understanding that veterinary advice supersedes general pet sitting protocols when an animal's health is in question. Question 7. System analysis indicates that a pet sitter is tasked with administering oral medication to a nervous and slightly agitated dog that is hesitant to be handled. The sitter needs to secure the dog safely and efficiently to administer the medication without causing undue distress or injury. Option A. Immediately grab the dog by the collar and pull it towards the sitter to administer the medication quickly. Option B. Approach the dog calmly. Speak in a soothing tone, offer a high-value treat to encourage voluntary approach, and then gently secure the dog for medication administration once it is relaxed. Option C. Attempt to force the dog into a specific position by pushing it down, even if it resists. Option D. Use a slip lead to quickly loop around the dog's neck and pull it into position without any prior interaction. The correct answer is B. Approach the dog calmly, speak in a soothing tone, offer a high-value treat to encourage voluntary approach, and then gently secure the dog for medication administration once it is relaxed. Explanation: this scenario is professionally challenging because it requires a pet sitter to balance the immediate need for safety and control of a potentially agitated animal with the ethical obligation to minimize stress and avoid causing harm. The pet sitter must make a rapid assessment of the animal's behavior and choose a restraint method that is both effective and humane, adhering to industry best practices and ethical guidelines. The correct approach represents best professional practice because it prioritizes the animal's well-being and safety through a gradual, positive reinforcement-based method. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes humane treatment, minimizing stress, and avoiding unnecessary force. Using a calm demeanor, offering a high-value treat, and allowing the dog to approach voluntarily are all techniques designed to build trust and reduce anxiety, thereby making restraint easier and safer for both the pet and the sitter. This method is also more likely to prevent future behavioral issues related to handling. An incorrect approach that involves immediately grabbing the dog by the collar and pulling it into position would be professionally unacceptable. This action could be perceived as aggressive by the dog, leading to increased fear, resistance, and potentially a bite. Ethically, it violates the principle of minimizing stress and avoiding unnecessary force. It also fails to consider the dog's emotional state, which is a core tenet of responsible pet care. Another incorrect approach, such as using a muzzle without assessing the need or attempting other calming techniques first, could also be problematic. While muzzles can be a safety tool, their immediate and unprompted use can be frightening for a dog and may not address the underlying cause of the agitation. Ethically, it bypasses less intrusive methods and could create a negative association with handling. A professional decision-making process for similar situations should involve a rapid assessment of the animal's body language and behavior, considering the context of the situation. The pet sitter should then evaluate available tools and techniques, prioritizing those that are least invasive and most likely to achieve cooperation through positive reinforcement. If initial attempts at calming and voluntary cooperation fail, the sitter should then consider more direct but still humane restraint methods, always being prepared to reassess and adapt their approach based on the animal's ongoing response. The ultimate goal is to achieve the necessary outcome, e.g., administering medication, moving the animal with the least amount of stress and risk to all parties involved. Question 8. Examination of the data shows a pet sitter is providing services in a client's home. During the visit, the pet sitter observes that a small, accessible electrical cord from a lamp is frayed and sparking intermittently near where the client's dog, a known chewer, is resting. The client's instructions for the visit did not mention any specific hazards or precautions regarding electrical cords. What is the most appropriate course of action for the pet sitter in this situation? Option A. Leave the lamp as is, assuming the client is aware of the condition and has accepted the risk, and continue with the scheduled pet care duties. Option B. Immediately unplug the lamp and secure the frayed cord to prevent the dog from accessing it, then contact the client to explain the situation and the action taken. Option C. Inform the client about the frayed cord and ask for their specific instructions on how to proceed before taking any action. Option D. Cover the frayed cord with tape to temporarily mitigate the sparking and continue with the visit, without informing the client until the next scheduled check-in. Correct answer is B. Immediately unplug the lamp and secure the frayed cord to prevent the dog from accessing it, then contact the client to explain the situation and the action taken. Explanation: this scenario is professionally challenging because it requires a pet sitter to balance the immediate needs of a pet with the owner's stated preferences and the inherent risks associated with a home environment. The pet sitter must exercise sound judgment to ensure the pet's safety without overstepping boundaries or creating liability. The National Association of Professional Pet Sitters, NAPS, certification emphasizes creating a safe environment, which involves proactive risk assessment and mitigation. The correct approach represents best professional practice because it prioritizes the pet's immediate safety and well-being by addressing a clear and present danger. This aligns with the ethical obligation of a pet sitter to act in the best interest of the animal under their care, as outlined by NAPS guidelines. It also demonstrates a commitment to responsible pet care by taking preventative measures to avoid potential harm, which is a core tenet of professional pet sitting. This proactive stance minimizes the likelihood of accidents or injuries, thereby protecting both the pet and the pet sitter. An incorrect approach that involves ignoring the observed hazard fails to uphold the duty of care owed to the pet. This is a direct violation of professional ethics and potentially NAPS guidelines regarding responsible pet care and safety. It demonstrates a lack of diligence and a failure to proactively identify and mitigate risks, which could lead to harm to the pet and subsequent liability for the pet sitter. Another incorrect approach that involves proceeding without addressing the hazard, assuming the owner's instructions supersede immediate safety concerns, is also professionally unacceptable. While client instructions are important, they do not absolve the pet sitter of their responsibility to ensure the pet's safety. This approach prioritizes convenience or avoidance of potential client conflict over the pet's well-being, which is a significant ethical lapse. It also fails to acknowledge the pet sitter's professional judgment and expertise in assessing and managing risks. The professional reasoning process for similar situations should involve a clear hierarchy of priorities. First, the immediate safety and well-being of the pet. Second, adherence to client instructions. And third, maintaining professional boundaries and communication. When a conflict arises, as in this scenario, the pet sitter must first assess the severity of the risk. If the risk is immediate and significant, the pet sitter has a professional and ethical obligation to intervene to mitigate that risk, even if it means deviating from a client's less critical instruction. Open and transparent communication with the client about the observed hazard and the steps taken to address it is crucial for maintaining trust and managing expectations. Question 9. Performance analysis shows that a pet sitter notices a dog they are caring for is unusually lethargic, has a decreased appetite, and is exhibiting mild tremors. The owner's emergency instructions include a veterinarian's contact information and a directive to contact them for any significant changes in the pet's health. What is the most appropriate immediate action for the pet sitter to take? Option A. Immediately call the owner and inform them that their dog is likely experiencing a serious illness. Option B. Continue with the scheduled pet sitting services as planned, monitoring the dog from a distance. Option C. Contact the veterinarian listed in the owner's emergency instructions to describe the symptoms and seek guidance. Option D. Assume the dog is just tired from playing and will recover on its own. Correct answer is C. Contact the veterinarian listed in the owner's emergency instructions to describe the symptoms and seek guidance. Explanation. This scenario is professionally challenging because a pet sitter must balance the pet's immediate well-being with the owner's instructions and the sitter's scope of practice. Misinterpreting subtle signs of illness can lead to delayed veterinary care, potentially worsening the pet's condition and violating the duty of care owed to the animal. Conversely, overreacting to minor changes could cause unnecessary stress to the pet and owner and incur avoidable costs. Careful judgment is required to differentiate between normal behavioral variations and genuine health concerns. The correct approach represents best professional practice because it prioritizes the pet's health and safety by seeking professional veterinary advice when a potential illness is identified. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes the sitter's responsibility to act in the best interest of the animal and to recognize when a situation is beyond their expertise. Promptly contacting the veterinarian, as outlined in the owner's emergency plan, ensures that a qualified professional can assess the situation and provide appropriate treatment, thereby fulfilling the sitter's duty of care and mitigating potential harm. An incorrect approach of assuming the pet will recover on its own is a significant ethical failure. It demonstrates a lack of diligence and a disregard for the potential for serious illness, which could lead to severe consequences for the pet and potential liability for the sitter. This approach violates the core principle of acting in the animal's best interest. Another incorrect approach of immediately contacting the owner with a diagnosis without consulting a veterinarian is also professionally unacceptable. While communication with the owner is important, a pet sitter is not a veterinarian and should not attempt to diagnose illnesses. This can lead to misinformation, anxiety for the owner, and potentially delay proper veterinary intervention. It oversteps the sitter's professional boundaries and expertise. A third incorrect approach of continuing with the scheduled services as if nothing is wrong, despite observing concerning symptoms, is a critical failure. This demonstrates negligence and a failure to recognize and respond to a potential health crisis. It directly contravenes the ethical obligation to monitor the pet's well-being and to take appropriate action when signs of distress or illness are present. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and document any changes in the pet's behavior, appetite, elimination, or physical appearance. 2. Compare these observations against the pet's normal baseline behavior. 3. If concerning signs are noted, consult the owner's provided emergency contact information and veterinary details. 4. If the owner's plan includes contacting the veterinarian for specific symptoms, follow that directive. 5. If the situation appears urgent or the owner's plan is unclear, err on the side of caution and contact the veterinarian directly, informing the owner as soon as reasonably possible. 6. Always operate within the scope of practice as a pet sitter, recognizing when professional veterinary expertise is required. Question 10. The assessment process reveals that a new client has expressed a strong desire for frequent updates on their pet's well-being during a week-long house-sitting engagement. They have specifically mentioned wanting to know about feeding, potty breaks, and general mood. Which of the following communication strategies best optimizes client relationship management and upholds professional standards? Option A. Wait for the client to contact you to inquire about their pet's status before providing any information, to avoid appearing overly anxious or intrusive. Option B. Inform the client that you will only contact them if there is a significant problem with their pet, as you do not want to bother them with routine matters. Option C. Send multiple text messages throughout the day, detailing every feeding, potty break, and minor behavioral observation, and include at least one photo or video with each update. Option D. Propose a daily summary report via text message, including brief notes on feeding, elimination, and observed behavior, and offer to send a photo or short video if something noteworthy occurs, while also assuring them you will reach out immediately if any concerns arise. Correct answer is D. Propose a daily summary report via text message, including brief notes on feeding, elimination, and observed behavior, and offer to send a photo or short video if something noteworthy occurs, while also assuring them you will reach out immediately if any concerns arise. Explanation. This scenario presents a common challenge in client communication, managing expectations and addressing concerns proactively to maintain trust and ensure service quality. The professional pet sitter must balance the client's desire for constant updates with the practical realities of providing care. Overpromising or underdelivering on communication can lead to misunderstandings, dissatisfaction, and potential breaches of professional conduct by failing to uphold service agreements or client care standards. The correct approach emphasizes establishing clear communication protocols upfront and providing timely, relevant updates without overwhelming the client or compromising the pet's care. This aligns with the National Association of Professional Pet Sitters, NAP's Code of Ethics, which stresses clear and honest communication, transparency, and prioritizing the well-being of the animal. By setting expectations regarding communication frequency and methods, the pet sitter demonstrates professionalism, builds trust, and ensures the client feels informed and secure. This proactive management of communication is a cornerstone of effective client relationship management in the pet sitting industry. An incorrect approach that involves providing excessive, unsolicited updates can be seen as unprofessional and potentially intrusive. It may suggest a lack of focus on the primary task of pet care, or an attempt to overcompensate for potential service gaps. This can lead to client anxiety and a perception that the pet sitter is not confident in their ability to provide care. Ethically, it deviates from efficient service delivery and can create an unnecessary burden on both parties. Another incorrect approach failing to provide any updates beyond the initial confirmation is a significant ethical and professional failing. This demonstrates a lack of diligence, transparency, and respect for the client's peace of mind. It directly contravenes the expectation of regular communication inherent in a professional pet sitting service agreement and can lead to severe client dissatisfaction and potential complaints. It suggests a disregard for the client's emotional investment in their pet and a failure to uphold the trust placed in the sitter. A third incorrect approach, waiting for the client to initiate contact before providing any information, is equally problematic. This passive communication style can create anxiety for the client, who is entrusting their beloved pet to a stranger. It suggests a reactive rather than proactive approach to client management and can be interpreted as a lack of commitment to keeping the client informed. This can erode trust and damage the professional relationship, as it fails to meet the implicit expectation of regular, reassuring updates. Professional decision-making process should involve 1. Understanding the client's communication preferences during the initial consultation. 2. Establishing a clear communication plan outlining frequency, methods, and types of updates. 3. Proactively providing agreed-upon updates, focusing on the pet's well-being and any relevant observations. 4. Responding promptly and professionally to client inquiries. 5. Documenting all communications for reference. This systematic approach ensures transparency, manages expectations, and fosters a strong, trusting client relationship, adhering to industry best practices and ethical guidelines. Question 11. Analysis of a situation where a dog in your care, a golden retriever named Buddy, begins to exhibit lethargy, decreased appetite, and mild vomiting after a routine walk. The owner is out of town and has provided emergency contact information and their veterinarian's details. What is the most appropriate course of action for a certified professional pet sitter? Option A. Contact the owner immediately to inform them of Buddy's symptoms and recommend they consult their veterinarian, offering to transport Buddy if they approve. Option B. Immediately take Buddy to the nearest emergency veterinary clinic without contacting the owner, as the symptoms could indicate a serious issue. Option C. Administer over-the-counter antacid medication that you have at home, hoping it will resolve the symptoms before the owner returns. Option D. Wait to see if Buddy's symptoms improve on their own over the next 24 hours before contacting the owner or seeking veterinary advice. The correct answer is A. Contact the owner immediately to inform them of Buddy's symptoms and recommend they consult their veterinarian, offering to transport Buddy if they approve. Explanation. The scenario presents a common challenge for professional pet sitters, recognizing and responding appropriately to potential health issues in their care. This requires a balance between providing attentive care and understanding the limits of their professional scope, especially when dealing with animal health. The professional challenge lies in accurately assessing the severity of symptoms, knowing when to escalate to a veterinarian, and communicating effectively with the pet owner, all while adhering to ethical standards and potentially implied contractual obligations for the pet's well-being. The correct approach represents best professional practice because it prioritizes the animal's welfare by seeking expert veterinary advice promptly. This aligns with the ethical responsibility of a pet sitter to act in the best interest of the animal. Furthermore, it demonstrates due diligence and a commitment to professional standards, minimizing liability for the pet sitter by involving a qualified professional in diagnosing and treating the condition. This proactive stance also fosters trust with the pet owner. An incorrect approach that involves delaying veterinary consultation or attempting to self-diagnose and treat the pet is professionally unacceptable. This failure constitutes a breach of the duty of care owed to the animal and the owner. It could lead to a worsening of the animal's condition, potentially causing unnecessary suffering and incurring higher veterinary costs later. Ethically, it is a dereliction of responsibility. From a regulatory perspective, while the National Association of Professional Pet Sitters Certification, NAPS, may not have specific statutes like a veterinary board, its certification implies adherence to a code of conduct that mandates prioritizing animal health and safety, which this approach violates. Another incorrect approach, such as immediately assuming the worst-case scenario and overwhelming the owner with alarmist information without a veterinary diagnosis, is also professionally unsound. While well-intentioned, it can cause undue distress to the owner and may not be factually accurate, potentially damaging the professional relationship. It bypasses the necessary step of professional veterinary assessment, which is the cornerstone of responsible pet care management. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and document all symptoms thoroughly. 2. Assess the severity and urgency of the symptoms based on general knowledge of common pet ailments. 3. Consult the pet owner's provided emergency contact information and veterinarian details. 4. If symptoms are concerning or rapidly progressing, contact the owner immediately to discuss seeking veterinary attention. 5. If the owner is unreachable or the situation is critical, contact the owner's designated veterinarian or an emergency veterinary clinic. 6. Follow the veterinarian's instructions meticulously. 7. Maintain clear and detailed records of all observations, communications, and actions taken. Question 12. Benchmark analysis indicates that a client has requested a pet sitter to administer medication to their cat, which was not part of the initial service agreement. The client is currently out of town and has only provided verbal instructions for the medication. Which of the following approaches best aligns with professional pet sitting business practices and ethical guidelines? Option A. Administer the medication as verbally instructed and then send a follow-up invoice for the additional service, assuming the client will pay for the unexpected task. Option B. Administer the medication, but only if the pet sitter feels comfortable and knowledgeable about the specific medication, without seeking further written confirmation from the client. Option C. Politely decline to administer the medication, explaining that it was not included in the original service agreement, and offering to refer the client to a veterinary technician or emergency veterinary service if immediate administration is critical, while also suggesting a follow-up discussion to amend the service agreement for future needs. Option D. Proceed with administering the medication as verbally instructed, assuming the client implicitly wants the service performed and will be grateful for the extra effort. The correct answer is C. Politely decline to administer the medication, explaining that it was not included in the original service agreement and offering to refer the client to a veterinary technician or emergency veterinary service if immediate administration is critical, while also suggesting a follow-up discussion to amend the service agreement for future needs. Explanation. This scenario presents a professional challenge because it requires a pet sitter to balance client expectations with the inherent risks and responsibilities of pet care, all while adhering to professional standards and ethical obligations. The core of the challenge lies in managing potential liability and ensuring client trust through transparent and responsible communication. The correct approach represents best professional practice because it prioritizes documented communication and proactive risk management. By obtaining explicit written consent for all services and clearly outlining limitations and emergency protocols, the pet sitter establishes a professional boundary, protects themselves from potential disputes, and ensures the client is fully informed and has agreed to the terms of service. This aligns with the ethical duty of care and the professional expectation of transparency and accountability within the pet sitting industry, as generally understood by professional associations like the National Association of Professional Pet Sitters. An incorrect approach that involves verbal agreements for services beyond the initial scope is professionally unacceptable because it lacks documentation, creating ambiguity and increasing the risk of misunderstandings or disputes. This can lead to situations where the pet sitter is expected to perform tasks they are not prepared for or insured for, potentially violating their professional liability coverage and ethical guidelines. Another incorrect approach, such as assuming the client implicitly wants additional services without explicit confirmation, is ethically flawed. It bypasses the client's autonomy and can lead to services being performed that the client may not want or be able to afford, or that the pet sitter is not equipped to handle safely. This erodes trust and professionalism. Finally, an approach that involves performing services without clear consent, even if perceived as beneficial, is a significant ethical and professional misstep. It demonstrates a lack of respect for the client's wishes and can expose the pet sitter to liability if something goes wrong. Professional decision-making in such situations should always involve a framework of clear communication, documented agreements, and a commitment to acting within the agreed-upon scope of services, always prioritizing the safety and well-being of the pet and the integrity of the professional relationship. Question 13. Process analysis reveals that a pet sitter is caring for a dog exhibiting sudden and persistent destructive chewing when left alone, a behavior not previously documented by the owner. The sitter has observed the dog pacing and vocalizing excessively during these periods. What is the most appropriate course of action for the pet sitter? Option A. Immediately begin implementing a strict timeout procedure whenever the dog exhibits destructive chewing to deter the behavior. Option B. Inform the owner that this behavior is common in separation anxiety and suggest the owner research and implement advanced behavioral modification techniques independently. Option C. Recommend to the owner that the dog be evaluated by a veterinarian to rule out any underlying medical conditions contributing to the anxiety and destructive behavior, and consult with them on appropriate management strategies. Option D. Advise the owner to purchase a new, more durable chew toy, assuming the current toys are simply inadequate for the dog's needs. Correct answer is C. Recommend to the owner that the dog be evaluated by a veterinarian to rule out any underlying medical conditions contributing to the anxiety and destructive behavior, and consult with them on appropriate management strategies. Explanation. This scenario presents a professional challenge due to the inherent unpredictability of animal behavior and the potential for misinterpretation of signals, which can lead to ineffective or even harmful interventions. A pet sitter must exercise careful judgment to ensure the safety and well-being of the animal, while also managing client expectations and adhering to professional standards. The core of the challenge lies in distinguishing between normal behavioral variations and indicators of distress or underlying medical issues that require professional veterinary attention. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment of the behavioral issue. This involves gathering comprehensive information from the owner, observing the pet's behavior in its environment, and consulting with veterinary professionals when necessary. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes the sitter's responsibility to provide competent care, recognize signs of illness or distress, and act in the best interest of the animal. Seeking professional veterinary advice is a critical ethical and practical step when behavioral changes are significant or persistent, as it ensures that medical causes are ruled out and appropriate treatment plans are developed. This proactive and collaborative approach minimizes risk and maximizes the likelihood of a positive outcome for the pet. An incorrect approach that involves immediately implementing a drastic training technique without understanding the root cause is professionally unacceptable. This fails to meet the NAPS standard of care, which requires a thorough assessment before intervention. Such an approach could exacerbate the behavioral issue, cause distress to the animal, and potentially lead to injury, violating the sitter's duty of care. Ethically, it demonstrates a lack of due diligence and a disregard for the animal's welfare. Another incorrect approach, such as ignoring the behavior with the assumption it will resolve on its own, is also professionally unsound. This neglects the sitter's responsibility to monitor the pet's well-being and report any significant changes. It could allow a treatable medical condition to worsen or a behavioral problem to become ingrained, potentially leading to negative long-term consequences for the pet and a breach of trust with the owner. This approach fails to uphold the NAP's commitment to proactive care and responsible pet management. Finally, an approach that involves offering unqualified advice on complex behavioral modification without consulting a veterinarian or certified animal behaviorist is ethically problematic. While pet sitters can offer general advice based on their experience, diagnosing and prescribing solutions for significant behavioral issues falls outside their scope of practice and could be detrimental to the pet's health and the owner's understanding. This oversteps professional boundaries and could lead to ineffective or harmful interventions, violating the principle of acting within one's expertise. Professionals should employ a decision-making framework that begins with active listening and information gathering from the owner. This is followed by direct observation of the pet's behavior in its natural environment. If the behavior is concerning, persistent, or appears to be linked to physical discomfort, the next critical step is to consult with a veterinarian to rule out any underlying medical causes. Based on veterinary findings and the owner's input, the sitter can then develop a safe and appropriate care plan, which may include simple management strategies or recommendations for professional behavioral training. Throughout this process, clear communication with the owner is paramount. Question 14. Research into a client's request for a pet sitter to administer a specific, non-prescription dietary supplement to their dog, which the client claims will improve the dog's coat condition, presents a professional dilemma. The pet sitter has no prior knowledge of this supplement or its efficacy, Which of the following actions best adheres to professional standards and regulatory guidelines for pet sitters? Option A. Advise the client that administering any new supplement requires a veterinarian's approval and offer to document the client's request for veterinary consultation. Option B. Agree to administer the supplement as requested, assuming that if the client purchased it, it must be safe. Option C. Inform the client that coat condition is a cosmetic issue and not within the pet sitter's purview to address. Option D. Research the supplement online and, if reviews are generally positive, administer it to the dog. The correct answer is A. Advise the client that administering any new supplement requires a veterinarian's approval and offer to document the client's request for veterinary consultation. Explanation. This scenario presents a professional challenge because a pet sitter is asked to deviate from standard, evidence-based nutritional advice for a client's pet. The challenge lies in balancing client requests with the pet's well-being and adhering to professional standards and potential regulatory guidelines concerning animal care and nutrition. Careful judgment is required to ensure the pet's health is not compromised by unverified or potentially harmful dietary changes. The correct approach represents best professional practice because it prioritizes the pet's health and safety by consulting with a veterinarian. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes acting in the best interest of the animal and seeking professional veterinary advice when health concerns arise, including dietary issues. It also implicitly acknowledges that pet sitters are not qualified to diagnose or prescribe dietary changes, which falls under the purview of veterinary medicine. This approach ensures that any dietary recommendations are based on scientific evidence and tailored to the individual pet's needs, as determined by a licensed professional. An incorrect approach that involves immediately agreeing to the client's request without further consultation is professionally unacceptable. This fails to uphold the duty of care owed to the animal and could lead to adverse health consequences for the pet. It also bypasses the expertise of a veterinarian, potentially violating ethical guidelines that require pet sitters to recognize the limits of their knowledge and refer to veterinary professionals when necessary. Furthermore, it could expose the pet sitter to liability if the pet experiences negative health outcomes due to the unverified dietary change. Another incorrect approach, such as recommending a specific brand of food based on personal preference or anecdotal evidence, is also professionally unacceptable. This is not based on scientific principles or the individual needs of the pet and could be detrimental. It oversteps the pet sitter's role and enters the realm of veterinary advice without the necessary qualifications or diagnostic information. The professional reasoning process for similar situations should involve a clear understanding of the pet sitter's scope of practice. When faced with a client's request regarding nutrition that goes beyond general feeding instructions or standard dietary needs, the professional should 1. Acknowledge the client's concern or request. 2. Assess if the request falls within their expertise or requires professional veterinary input. 3. If veterinary input is needed, politely and professionally explain the importance of consulting a veterinarian for personalized dietary advice, emphasizing that this ensures the pet's optimal health and safety. 4. Document the client's request and the professional's response, including the recommendation to consult a veterinarian. Question 15. The risk matrix shows a high probability of a dog exhibiting leash reactivity towards other dogs during walks, based on the client's detailed history provided. The client is requesting a standard daily walking service. What is the most responsible course of action for the professional pet sitter? Option A. Accept the booking for standard walks without mentioning the reactivity, assuming the pet sitter can manage it on the day. Option B. Discuss the identified leash reactivity with the client, explain the potential risks involved, and propose a modified walking plan that includes strategies for managing reactivity, such as avoiding peak hours or busy areas, and potentially recommending professional training. Option C. Decline the booking immediately due to the high risk of reactivity, without further discussion or exploration of solutions. Option D. Agree to the standard walks, but inform the client that the pet sitter will not be responsible for any incidents related to leash reactivity. The correct answer is B. Discuss the identified leash reactivity with the client, explain the potential risks involved, and propose a modified walking plan that includes strategies for managing reactivity, such as avoiding peak hours or busy areas, and potentially recommending professional training. Explanation. Scenario analysis. This scenario presents a common ethical dilemma for professional pet sitters, balancing client expectations with the realities of pet care and potential liabilities. The challenge lies in accurately assessing the risks associated with a pet's known behavioral issues and communicating these risks transparently to the client, while also ensuring the pet receives adequate care. Failure to do so can lead to misunderstandings, injury to the pet or sitter, and significant financial and reputational damage. Correct approach analysis. The correct approach involves a thorough assessment of the pet's history, a clear and honest discussion with the client about the identified risks, and a proactive plan to mitigate those risks. This aligns with the National Association of Professional Pet Sitters, NAP's, Code of Ethics, which emphasizes client communication, transparency, and prioritizing the safety and well-being of the animals in their care. It also directly addresses insurance and liability considerations by acknowledging potential risks and implementing measures to prevent incidents, thereby reducing the likelihood of claims. This approach demonstrates professionalism, builds trust, and protects both the pet sitter and the client. Incorrect approaches analysis. One incorrect approach involves downplaying the risks to secure the booking. This is ethically unsound and violates the NAP's Code of Ethics regarding honesty and transparency. It creates a false sense of security for the client and exposes the pet sitter to significant liability if an incident occurs, potentially invalidating insurance coverage due to non-disclosure of known risks. Another incorrect approach is to refuse service outright without attempting to understand the situation or propose solutions. While safety is paramount, a professional pet sitter should strive to find solutions where possible. This approach may be seen as lacking in client service and could be interpreted as an unwillingness to engage with the complexities of pet care, which is contrary to the spirit of professional pet sitting. A third incorrect approach is to accept the booking without discussing the risks or implementing any mitigation strategies. This demonstrates a failure to conduct a proper risk assessment and a disregard for potential liabilities. It leaves the pet sitter vulnerable to claims of negligence if an incident occurs, and their insurance may not cover damages if it can be proven that known risks were not addressed. Professional reasoning. Professionals should approach such situations by first gathering all necessary information about the pet's behavior and any previous incidents. This should be followed by an open and honest conversation with the client, outlining the identified risks and proposing a tailored care plan that includes specific strategies for managing the pet's behavior safely. This proactive communication and risk mitigation are crucial for fulfilling professional obligations, maintaining client trust, and ensuring adequate insurance coverage. Question 16. The performance metrics show that a dog in your care, who is on a strict portion-controlled diet for weight management as directed by the owner, is exhibiting persistent begging behavior and appears to be constantly seeking more food. The owner's feeding protocol clearly states the exact amount of food to be given at specific times. What is the most professional and ethical course of action? Option A. Assume the dog is not receiving enough food and provide a larger, more palatable meal to ensure its immediate satisfaction. Option B. Ignore the owner's specific feeding instructions and feed the dog an arbitrary amount of food based on your assessment of its hunger. Option C. Contact the owner immediately to discuss the dog's behavior and confirm the feeding protocol, while continuing to adhere strictly to the provided instructions until further guidance is received. Option D. Immediately increase the dog's food portion at the next feeding to satisfy its apparent hunger, as the owner's instructions might be outdated. The correct answer is D. Immediately increase the dog's food portion at the next feeding to satisfy its apparent hunger, as the owner's instructions might be outdated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pet sitter to balance the immediate needs of a pet with the owner's specific instructions and potential underlying health concerns. Misinterpreting dietary needs or ignoring owner directives can lead to serious health consequences for the pet, impacting the sitter's reputation and potentially leading to liability. The sitter must exercise careful judgment to ensure the pet's well-being while respecting the client's wishes and established feeding protocols. Correct approach analysis. The correct approach prioritizes direct communication with the owner and adherence to their established feeding plan. This aligns with the National Association of Professional Pet Sitters, NAP's, Code of Ethics, which emphasizes client trust, clear communication, and acting in the best interest of the pet as directed by the owner. Following the owner's established protocol for portion size and frequency is paramount, as they are the most knowledgeable about their pet's specific needs and any potential sensitivities or medical conditions. This approach demonstrates professionalism, reliability, and a commitment to providing personalized care. Incorrect approaches analysis. One incorrect approach involves unilaterally deciding to increase the food portion size based on the pet's perceived hunger. This is a regulatory and ethical failure because it bypasses the owner's explicit instructions and assumes the sitter has superior knowledge of the pet's dietary requirements. This could violate the owner's trust and potentially exacerbate an underlying health issue, such as diabetes or obesity, which the owner is managing. Another incorrect approach is to ignore the owner's specific feeding instructions and instead feed the pet a larger, more palatable meal. This is a significant ethical breach. It demonstrates a lack of respect for the client's directives and a failure to prioritize the pet's health as defined by its owner. This action could lead to digestive upset, allergic reactions, or interfere with a veterinarian-prescribed diet, all of which are detrimental to the pet's well-being and a violation of professional duty of care. Third incorrect approach is to assume the pet is simply starving and feed it an arbitrary amount of food without consulting the owner. This is a failure in professional judgment and communication. It presumes a problem without verification and acts on that assumption, potentially leading to overfeeding or feeding inappropriate food. Professional pet sitters are expected to be observant, but also to seek clarification from the owner before deviating from established routines, especially concerning something as critical as diet. Professional reasoning. When faced with a situation where a pet appears unusually hungry or exhibits behavior that might suggest a dietary issue, a professional pet sitter should always 1. Review the owner's provided feeding instructions and emergency contact information. 2. Observe the pet for any other signs of distress or illness. 3. Contact the owner immediately to discuss the observed behavior and seek clarification on the feeding plan. 4. If the owner is unreachable and the pet appears to be in distress, contact the owner's designated emergency contact or veterinarian for guidance. This systematic approach ensures that the pet's needs are met while respecting the owner's authority and established care protocols, thereby upholding professional standards and ethical obligations. Question 17. Which approach would be most appropriate for a professional pet sitter who notices a dog in their care has developed a sudden, persistent cough and seems lethargic, deviating significantly from its normal energetic demeanor? Option A. Monitor the dog closely for the next 24 hours to see if the cough and lethargy resolve on their own before taking any further action. Option B. Contact the dog's veterinarian immediately to describe the symptoms and seek professional advice, while also informing the client of the situation. Option C. Administer a small dose of an over-the-counter cough suppressant intended for human use, as it might help alleviate the symptoms. Option D. Continue with the scheduled feeding and walking routine, assuming the dog is just tired and will recover without intervention. The correct answer is B. Contact the dog's veterinarian immediately to describe the symptoms and seek professional advice, while also informing the client of the situation. Explanation. This scenario presents a common challenge for professional pet sitters, recognizing potential signs of illness in an animal under their care and knowing the appropriate course of action. The professional's responsibility extends beyond basic care to include vigilance for the animal's well-being, which is a core ethical and professional obligation. The challenge lies in distinguishing between minor, transient discomfort and a more serious health issue requiring immediate veterinary attention, all while adhering to client instructions and maintaining clear communication. The correct approach represents best professional practice because it prioritizes the animal's health and safety above all else. By immediately contacting the designated veterinarian and informing the client, the pet sitter is acting responsibly and proactively. This aligns with the National Association of Professional Pet Sitters, NAP's, Code of Ethics, which emphasizes the sitter's duty to observe the health of the animals in their care and to seek professional veterinary advice when necessary. Prompt communication ensures that the client is aware of the situation and can make informed decisions in consultation with their veterinarian, and it allows for timely diagnosis and treatment for the pet. An incorrect approach that involves waiting to see if the symptoms resolve on their own is a failure to act with due diligence. This could lead to a worsening of the animal's condition, potentially causing unnecessary suffering and increasing treatment costs. Ethically, this demonstrates a lack of commitment to the animal's welfare. Another incorrect approach, such as administering over-the-counter human medication without veterinary guidance, is a direct violation of professional standards and potentially dangerous. It bypasses the expertise of a veterinarian, who is qualified to diagnose and prescribe appropriate treatments, and could lead to adverse drug interactions or masking of serious symptoms. Finally, ignoring the symptoms entirely and continuing with routine care without any notification to the client or veterinary professional is a severe dereliction of duty, violating both ethical obligations and potentially client trust and safety protocols. Professionals should employ a decision-making framework that begins with thorough observation of the animal's behavior and physical condition. If any deviation from the norm is noted, especially concerning appetite, elimination, energy levels, or physical signs of distress, the next step is to consult the client's provided emergency contact information and veterinary details. The default action for any concerning symptom should be to contact the veterinarian for guidance, followed by informing the client. This layered approach ensures that the animal's health is addressed promptly and professionally, while respecting the client's relationship with their veterinarian. Question 18. The review process indicates that a new client has expressed concerns about the standard client contract, specifically questioning the clauses related to emergency veterinary care authorization and the sitter's liability for pre-existing pet conditions. The pet sitter needs to decide how to proceed to ensure a clear and protective agreement. Option A. Agree to remove the clauses related to emergency veterinary care and pre-existing conditions to avoid conflict and secure the client's business. Option B. Propose adding a clause that clearly defines the scope of emergency veterinary care the sitter is authorized to seek, including a predetermined spending limit or a requirement to contact the owner within a specified timeframe for non-life-threatening situations, and explicitly state that the sitter is not liable for pre-existing conditions unless directly exacerbated by the sitter's negligence. Option C. Inform the client that the contract is standard and legally binding, and that any deviations would require a separate, more expensive service agreement. Option D. Advise the client to consult their own legal counsel to review the contract and make any necessary modifications, without offering any specific suggestions or amendments from the sitter's perspective. The correct answer is B. Propose adding a clause that clearly defines the scope of emergency veterinary care the sitter is authorized to seek, including a predetermined spending limit or a requirement to contact the owner within a specified timeframe for non-life-threatening situations, and explicitly state that the sitter is not liable for pre-existing conditions unless directly exacerbated by the sitter's negligence. Explanation. This scenario presents a common implementation challenge for professional pet sitters, ensuring client contracts are comprehensive and legally sound to protect both the sitter and the client. The challenge lies in anticipating potential issues and clearly defining responsibilities, services, and liabilities within the agreement. Careful judgment is required to draft a contract that is both protective and accessible to the client, avoiding ambiguity that could lead to disputes. The correct approach involves proactively identifying and addressing potential service gaps or client expectations that might not be explicitly covered in a standard contract. This demonstrates a commitment to client care and risk mitigation, aligning with the ethical standards of professional pet sitting. By seeking clarification and proposing amendments, the pet sitter ensures mutual understanding and a legally robust agreement, thereby upholding professional integrity and minimizing future misunderstandings. This proactive stance is crucial for building trust and a sustainable business. An incorrect approach would be to assume that a generic contract is sufficient without considering the specific needs of the client and their pets. This failure to customize the agreement can lead to situations where the sitter is not adequately covered for certain services or emergencies, or where the client has expectations not met by the contract's terms. Ethically, this can be seen as a lack of due diligence and a potential breach of professional responsibility. Another incorrect approach is to dismiss the client's concerns about contract clauses without proper consideration or explanation. This can be perceived as unprofessional and dismissive, potentially damaging the client relationship and creating an environment ripe for future conflict. It also fails to address potential ambiguities that could have legal ramifications. Professionals should approach contract review by first understanding the core services offered, and then considering potential variables such as pet behavior, health issues, environmental factors, and emergency protocols. They should then draft a contract that clearly outlines these elements, including scope of services, fees, cancellation policies, liability limitations, and emergency contact information. When a client raises concerns or requests modifications, the professional should engage in open communication, explain the rationale behind existing clauses, and be willing to negotiate reasonable amendments that maintain legal integrity and address client needs. This iterative process ensures a contract that is both protective and mutually agreeable. Question 19. The analysis reveals that a professional pet sitter is caring for a dog with a known history of seizures. During a routine visit, the dog experiences a severe, prolonged seizure that does not subside within the typical time frame. The pet owner is unreachable by phone, and their emergency contact is also unavailable. The pet sitter has the owner's signed authorization form on file, which grants permission for emergency veterinary treatment up to a specified financial limit. What is the most appropriate course of action for the pet sitter? Option A. Contact a neighbor who is familiar with the dog to ask for advice on how to handle the prolonged seizure. Option B. Attempt to administer a prescribed anti-seizure medication that the owner has on hand without veterinary guidance to manage the seizure. Option C. Wait for the owner to respond to multiple calls and texts before taking any action to ensure direct consent for this specific emergency. Option D. Transport the dog immediately to the nearest veterinary emergency clinic and inform the owner as soon as contact is re-established. Correct answer is D. Transport the dog immediately to the nearest veterinary emergency clinic and inform the owner as soon as contact is re-established. Explanation. The analysis reveals a scenario where a professional pet sitter must act decisively during an emergency, highlighting the critical importance of robust emergency preparedness plans. This situation is professionally challenging because it demands immediate, informed action under stressful conditions, where the pet's well-being is paramount and potential liability for the sitter is significant. The pet sitter's adherence to established protocols, communication with the pet owner, and knowledge of emergency veterinary care are all tested. The correct approach represents best professional practice because it prioritizes the pet's immediate safety and medical needs while maintaining clear communication with the owner and adhering to established emergency protocols. This aligns with the National Association of Professional Pet Sitters, NAPS, Code of Ethics, which emphasizes the sitter's responsibility to act in the best interest of the animal and to maintain open and honest communication with clients. A well-defined emergency plan, including pre-established veterinary contacts and owner authorization for emergency treatment, is a cornerstone of responsible pet sitting, mitigating risks for both the pet and the professional. An incorrect approach that involves delaying care to await explicit owner permission for a life-threatening condition is a significant regulatory and ethical failure. NAPS guidelines implicitly require sitters to exercise professional judgment in emergencies when direct owner contact is impossible, failing to seek immediate veterinary attention when a pet is in critical distress, even with the intention of respecting owner autonomy, can lead to irreversible harm or death, violating the core duty of care. Another incorrect approach, such as administering unprescribed medication or attempting complex first aid without proper training or authorization, constitutes a breach of professional conduct and could lead to further injury or adverse reactions, potentially violating local animal welfare laws and NAPS standards regarding scope of practice. Finally, an approach that neglects to document the incident and the actions taken is a failure in professional record keeping, which is essential for accountability, client communication, and potential legal protection. Professional reasoning in such situations should follow a clear decision-making framework. 1. Assess the immediate threat to the pet's life or severe suffering. 2. Consult the client's emergency contact information and the pre-approved emergency plan. 3. If direct owner contact is impossible and the situation is life-threatening, proceed with authorized emergency veterinary care. 4. Document all actions, observations, and communications meticulously. 5. Inform the owner as soon as reasonably possible. This framework ensures that the pet's welfare is prioritized while maintaining professional integrity and adhering to industry standards. Question 20. The efficiency study reveals that a pet sitter, while performing a routine check on a dog in their care, discovers a small, superficial cut on the dog's paw that appears to be bleeding slightly. The owner's instructions were to monitor for any changes in behavior or physical condition, and to contact them immediately if anything significant arose. The pet sitter has basic first aid training for pets, which includes cleaning minor wounds and applying a simple bandage. However, the cut seems deeper than initially assessed and the dog is showing signs of discomfort. What is the most appropriate course of action for the pet sitter? Option A. Clean the wound gently. Apply a clean, non-stick bandage and monitor it closely, documenting the incident for the owner. Option B. Apply a topical antiseptic and a pressure bandage, then wait for the owner to return to assess the situation. Option C. Contact a veterinarian to describe the wound and the dog's discomfort, and follow their professional guidance. Option D. Immediately contact the pet owner to describe the wound and seek their specific instructions on how to proceed. The correct answer is A. Clean the wound gently, apply a clean, non-stick bandage and monitor it closely, documenting the incident for the owner. Explanation. This scenario is professionally challenging because it requires a pet sitter to make critical decisions regarding a pet's immediate health needs while balancing the owner's instructions and the sitter's scope of practice. The pet sitter must assess the severity of the wound, determine if it falls within their training and certification capabilities, and act promptly to prevent further harm, all while respecting the owner's wishes and potential limitations. The correct approach represents best professional practice because it prioritizes the animal's welfare and adheres to the ethical guidelines of professional pet sitting. By contacting the veterinarian immediately, the pet sitter is acting within their scope of practice, seeking expert advice for a potentially serious medical issue. This demonstrates responsible care, a commitment to the pet's health, and adherence to the implied duty of care that professional pet sitters owe to their clients and the animals they care for. It also aligns with the National Association of Professional Pet Sitters, NAPS, certification standards, which emphasize the importance of recognizing when professional veterinary intervention is necessary. An incorrect approach involving attempting to manage the wound without veterinary consultation fails to recognize the limitations of a pet sitter's training. This could lead to improper bandaging techniques, infection, delayed healing, or exacerbation of the injury, all of which constitute a breach of the duty of care and potentially violate ethical standards that require pet sitters to act in the best interest of the animal. Another incorrect approach, such as only applying a basic bandage and waiting for the owner's return, neglects the immediate need for professional assessment and could result in significant harm to the pet. This demonstrates a lack of proactive care and a failure to uphold the professional responsibility to ensure the pet's well-being during the owner's absence. Relying solely on the owner's initial instructions without re-evaluating the situation when a wound appears to worsen is also a failure to exercise professional judgment and adapt care as needed. The professional decision-making process for similar situations should involve a clear assessment of the pet's condition, a thorough understanding of one's own training and certification limitations, and a commitment to seeking appropriate professional help when necessary. This includes having established protocols for emergencies, knowing when to contact a veterinarian, and communicating effectively with pet owners about their pet's health status and any recommended actions.